We're standing outside of the Tembeletu clinic.
We have been running this clinic now for almost 8 years. It's one of the largest clinics in the country seeing HIV positive patients.
Upwards of 20,000 patients have been initiated on HIV treatment here. Because they also collect data on these patients, we have access to populations to answer important questions related to the treatment rollout.
And it took some years to develop both the evidence base and the reputation that we can now answer questions the government asks us.
The key thing about HERO is that because it's a group of academics, they are very rigorous, so the integrity of the results is not questioned.
We were asked by government to look at the cost to South Africa of introducing new guidelines for HIV treatment, pulling in more HIV-infected people, raising eligibility for both adults and children.
Nothing in terms of the antiretroviral scale-up had ever been attempted. We were desperate for data, to understand what needed to be done.
And in order to tell the government what it would cost to do that, we used the data that we had from that clinic and came out with a kind of price tag.
They were the ones who turned around and said, this is how much it costs to save a South African life.
It was very easy then for the ministers to make a decision and then to sell the idea of seeking additional funding to our national treasury. So it was a critical piece of work that led to us taking a decision which the president of the country announced on World AIDS Day.
Basically, the South African government has doubled the HIV treatment budget over the last 3 years.
We now have an estimated 1.7 million people cumulatively on treatment.
All of these things had something to do with us working with them.
It's not as exciting as inventing a new cure, but if we can demonstrate that you can achieve the same thing for less, you can actually count the lives that you can save.